Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of infectious medicine is burn wound infections. This topic of burn wound infections we will discuss in 4 different sections. In the first section, we will talk about epidemiology of burn wound infections and also pathophysiology, how it develop and progress, and also what are different causative organisms that are commonly associated with the infection of the burn wounds. Then in the second section, we will talk about some signs of infection of the burn wounds, how we classify the burn wounds, and then some other clinical features associated with the infections of the burn wound. In the third section, then we will talk about the diagnosis of infection of the burn wound, biopsies, polymerase chain reaction, what are some complications associated with infections of the burn wounds and burn surgical wound infections. Then in the fourth and final section, we will talk about some treatment options available, which will be antimicrobial agents we can use for the treatment of infections of the burn wounds. Also, mupirocin and topical therapy, and sub-ascarclysis and tetanus immunization. So all this will be discussed in our today's topic of burn wound infections. So keep watching sqadia.com to learn about this topic.